Welcome to Ortho Reports. Today, we're diving into a really fascinating medical detective story. It starts with a routine surgery to fix a broken hip, but it takes a sudden, life-threatening turn. This is a story about a shocking discovery, a race against the clock, and some incredible medical teamwork. So let's set the scene. Hip fractures, especially from falls, are unfortunately something we see all the time in the elderly. But the complication we're about to explore, it is so far from common. It's the kind of thing that turns a standard procedure into a high-stakes surgical drama. Our story kicks off with an 85-year-old man who took a fall and fractured his hip. He was brought in for what is, for all intents and purposes, a very standard, very effective surgical repair. Now, the technique they used is called cephalomedullary nailing. Basically, surgeons put a metal rod down the center of the thigh bone and then drive a large screw through that rod into the ball of the hip joint. It creates this really stable internal frame, and the whole point is to let patients get back on their feet as quickly as possible. And you know what? Initially, the surgery went off without a hitch. The x-ray they took right there in the operating room showed the nail and the screw were exactly where they needed to be. I mean, it was a textbook success. But here's where the story takes a twist. The surgery itself might have been flawless, but what happened after led to a critical and, frankly, completely unforeseen complication. At first, the recovery seemed to be going just fine. He even had a minor fall about 2 weeks later, but the x-ray showed everything was still solid. So he was discharged to a rehab facility. But then, a week after that, a second fall. And this one changed everything, bringing on a whole new level of pain. So, of course, they took another x-ray, and what they saw was, well, it was unbelievable. That huge screw, the one that's supposed to be locked into the bone, had completely broken free. But it didn't just come loose. It had traveled. It had migrated deep into the patient's pelvis, a place it has absolutely no business being. This discovery set off alarm bells everywhere. A loose piece of surgical steel inside the pelvic cavity isn't just a problem, it's a ticking time bomb. It's surrounded by vital organs and, even worse, major blood vessels. So the immediate, urgent question for the medical team was this: what exactly is this wayward screw threatening right now? They needed a better look, and they needed it fast. A CT scan gave them the terrifying answer. The sharp tip of that screw was just 2 centimeters away from the iliac bifurcation. Now, this is a supercritical junction where the aorta, the body's main highway for blood, splits to go down each leg. A puncture there would be instantly catastrophic. Yeah, this wasn't just dangerous. It was a surgical minefield. Any little movement, any slight shift could puncture a major artery and cause a massive internal bleed. And to make matters 1,000 times worse, the patient was on blood thinners, which would just amplify any bleeding disaster. They rushed him to the operating room for an emergency exploratory surgery to try and get that screw out. But once they were inside, they realized the risk was just too high. The very act of trying to get to the screw could cause the fatal bleed they were trying to prevent. They had to make the incredibly tough call to abort the mission, close him up, and leave the screw right where it was. But this was not a problem that was going to sit still. 10 days go by, they do another scan, and sure enough, the screw was still on the move. It had crept another 5 millimeters closer to those major arteries. At that point, the team knew they couldn't wait any longer. A second attempt wasn't just an option, it was unavoidable. Okay, so this time, they couldn't leave anything to chance. This rescue mission needed a whole new strategy. It meant bringing together a specialized team to figure out how to tackle this unique and incredibly perilous problem. And this is where you see the real power of collaboration in medicine. You had the orthopedic team who knew the hardware, working with general surgeons who are the experts of the abdomen, and crucially, vascular surgeons who could jump in and control any catastrophic bleeding. It was a true multidisciplinary dream team. So with this new, meticulous plan, they went back in. The vascular team was scrubbed and literally standing by, ready to intervene at a moment's notice. The lead general surgeon carefully navigated that minefield, found the screw, and this time, got it out. No complications, a massive success. But hold on. Removing the screw didn't magically fix the original problem. The patient was now safe from this wandering piece of metal, but his hip was still broken, and now it had no hardware in it at all. Now, facing the idea of another major surgery, the patient and his family had to make a really tough decision. They felt the risks of one more operation were just too high, and they opted to let nature take its course, hoping against hope the fracture might just heal on its own. And here's the final, remarkable twist to the story. 4 months later, against all odds, new x-rays showed the fracture had healed completely. With a lot of intensive rehab, the patient was actually able to get back on his feet and start walking with a walker. So after all that, what can we actually learn from this incredible chain of events? Well, this case gives us some really crucial lessons for how to handle these complex, totally unexpected complications. So what's the big clinical message here? Well, first, you've got to have a high index of suspicion. That second fall wasn't just a bump, it was the event that kicked off this whole crisis. Second, use the right imaging. The x-ray showed there was a problem, but it was the CT scan that screamed, this is a life-threatening emergency. And finally, as this whole rescue proved, complex problems demand a collaborative team. Without orthopedic, general, and vascular surgeons all working together, the outcome here could have been tragic. This whole case is just a testament to careful planning, amazing teamwork, and having the courage to change course when you're facing extreme risk. It really highlights that in medicine, you have to be ready not just for the common stuff, but for that 1 in a million complication that you never thought you'd see. It really makes you think, doesn't it? How do teams truly prepare for the problem that isn't in any textbook?